Hi, my name is Samantha Willis. I am a licensed professional board certified counselor and registered play therapist from the state of Alabama. I work mostly with clients who have had at least one significant trauma in their life. I also work with the LGBTQ plus community, transgender community, pink community, poly community, and sex workers. I come across a lot of clients who might have substance issues in their life, but the approach that I take is called harm reduction. Okay, so I recognize the realities that poverty, class, racism, social isolation, past trauma, gender identity, gender based discrimination, other social inequalities affect both people's vulnerability to and capacity for effectively dealing with drug and alcohol related harm. So I don't attempt to minimize or ignore the very real and tragic harm and dangers associated with drug and alcohol use. So I wanted to say that before I really talk about this approach. So really, a lot of people say that marijuana is the gateway drug, but in my time of working with people who do suffer from drug and alcohol related issues, I believe as a clinician and also just a human being, that the gateway drug is trauma in a lot of cases. One reason I believe so strongly in harm reduction is because just treating drug and alcohol use would be treating a symptom of a larger issue. So I think we need to go to the root and treat that. So up to 59% of people who suffer from PTSD have substance use disorders. That is a very large percentage of people who do have PTSD. And I think also a lot more people have PTSD and symptoms of PTSD than what we recognize. And so, when I think about drug and alcohol usage, there are two main reasons I think people use, and those are fun and social reasons, and then there's pain. And a lot of times one bleeds into the other, and you're just finding a way to cope. Let's talk about what harm reduction is. Okay, so the first thing would be needle distribution and recovery programs that distribute sterile needles and other harm reduction supplies, recover used needles and other supplies, and provide information and containers for their safe disposal. I actually spent the past year living in St. John's, Newfoundland in Canada, and when I was there, I saw how drug usage was being addressed in such a different way there by having these programs where you can drop off and pick up as many needles as you want. And in Alabama, we don't have many programs like that. And that was kind of the norm in Canada. And so was harm reduction, kind of as a method for mental health care and physical health care clinicians to deal with these issues. Okay, so the next thing is to understanding drug use is a complex and multifaceted phenomenon that encompasses continuum of behaviors from severe abuse to total abstinence, and acknowledge that some ways of using drugs are clearly safer than others, and we're going to talk about some of those today. The next thing is substitution therapies that substitute illegal heroin with legal non-injection methadone and other prescribed opioids, which most of us have heard about that. The next thing is take-home programs that provide an antidote to things like opioids to reverse an overdose, and that prevents brain injury due to depressed breathing and death. And so that's another way we can do that. And the next thing would be supervised consumption facilities that help prevent overdose deaths and other harms by providing a safer, supervised environment for people using substances. Outreach and education services that make contact with people who use substances to encourage safer behaviors. Peer support programs that are groups run and attended by people who have used substances to improve their quality of life and to address gaps that surface. And there are definitely programs that work for some people and not for others. When I was in graduate school, one of the requirements of my substance use class was to go to a meeting, a 12-step meeting. And I did, and I saw, and I got to talk to people and kind of engage in the process and see what a meeting looked like. And I recognized how much meaning those meetings were holding for so many people who attended them. Is that for everyone? Absolutely not. But for these people, it was changing their life and improving their relationships. And the next thing would be impaired driving prevention campaigns that create awareness of the risk of driving under the influence of alcohol and other legal or illegal substances, because that is a really big issue. And, we are accountable for our actions. And so I think that's something really important to recognize, and to know what's safe and what's unsafe and the implications on other people around us. Okay, so let's talk about benefits of harm reduction. So reducing hepatitis and HIV, reducing overdose deaths and other early deaths among people who use substances, reduce injection substances use in public places, and reduce the number of used needles in public. And that's something that I've definitely seen in Birmingham, but I also saw it in St. John's as well. One day I walked outside in St. John's and there's just a needle on the ground, and that's very unsafe for people going through that area. It's a very busy city area. So reducing the sharing of needles and other substance use equipment, reducing crime and increase employment among people who use substances, and educate about safer injecting and smoking and reducing the frequency of use. And there are places throughout the U.S. who might specifically reach out to people who are recovering, and they might have jobs. I know in Birmingham there is a diner that serves that kind of role. And in St. John's, there were multiple facilities in which, cafes and places of that nature where everybody was recovering. Okay, some other things is educate about safer sex and sexual health and increase condom use, which, we all know and we all want to improve that, hopefully. We want to increase referrals to treatment programs and health and social services. Okay, so let's talk about what this means for individuals. So harm reduction makes it as easy as possible for people who use substances to get help. There isn't judgment there. If you're going to a clinician who uses a harm reduction framework, harm reduction services are open to all people who use substances at any stage in their substance use. I definitely will get clients who coincidentally they might come to me for trauma or transgender issues or, couples issues, within the kink or poly communities. But that's kind of one of the symptoms that's arisen. And that's one thing that's going on. And, it goes from being a symptom to just being fun and, having fun, or trying to, gather greater meaning in life or something of that. So I'm never going to tell my clients to stop. I'm just going to make sure that we do everything we can to prevent them from getting harmed. And, that comes down to if they're on medications for mental health issues, that it's not interfering with the medication, things like that too. I definitely work with a medical professional in that capacity. So help is available when someone using substances wants to move into a new direction. So this includes connecting to outreach, primary or other healthcare services, and accessing substance dependence treatment. So people who use substances are encouraged to participate in harm reduction activities. So these services aim to involve people in their own health by keeping them connected to the health system. So harm reduction can empower people to improve the quality of their life, which is vitally important, because then you need to question, Why am I using? Why is my life going in this direction? And see, is that something that's contributing positively to your life, or is it something that's harming you? Is it harming your relationships, or is it helping you? Is it helping your relationships? And, or is it just something that everyone around you is doing that you feel like you have to as well? I've met with a lot of individual clients, and maybe a partner is using and encouraging them to use as well. So I'm using this cocaine and I want you to as well, and you're no fun, and all that language that might be used by someone who might be abusive within relationships. And so I think that's very important to consider and to think about in terms of how is this affecting you and your relationships and as a human being. Okay, so what can you do if you're in the situation where you would like to reduce your harm and maybe go to a mental health care clinician? So first of all, you want to use language when you're looking for a clinician that would be something like harm reduction or non-judgmental approach. We see so much in the media about substance use that just tells you to stop. They hold you accountable, and it's some kind of, it feels judgmental. It feels potentially harmful, like you let clinician down. Some clinicians might have a, contract with their client, so they will not use. And so look for that language that's more positive in nature when you're looking for a clinician. And the next thing is to take steps of being safer. Okay, so this is something that upon my intake session with a client, first thing I'll tell them, please go buy a test kit. So in Birmingham, over the past few years, I have seen more and more deaths, and this could be like family members of clients, friends of clients, luckily none of my clients, but a lot of people have been dying from their drugs being laced. And when you see someone dying from marijuana use, there's definitely a problem there. So making sure that what you think you're taking is what you're taking. So go online, buy a test kit, please. That's something you can do today. Just go get your test kit and test everything before you consume it. Okay, so the next thing is to know where your substances come from. I definitely have seen clients who are like, oh, well, I kind of know the person who sells to me. Or it could be the other way of, oh, I know this person, I've known them for 15 years, and they're this great person, and I really trust them. All that language you would use over someone you very, very much so trust. But the issue with that is because, that person doesn't mean that you necessarily know where they got it from. Or maybe, your dealer knows very well where theirs came from, but then who had it before that. So unless it's one of those situations where you're growing things yourself, or you're buying it from, depending on where you live in the US, whether if it's like marijuana, if it's legalized and all that, you would pretty much know. I know in Canada when I lived there, yes, marijuana was legal, but only from the government stores. So therefore, a lot of people didn't like what was the government store, so people were still buying illegally, which means it could still be laced with something. So you want to be very mindful of how you buy things, and then no matter, just making it kind of a rule of no matter where you got it from, of testing it. One thing that I've seen more in the past couple of years really is cocaine. Cocaine usage skyrocketed in Birmingham. And, with that, I mean, the economy's doing well, for cocaine to be so popular, but people are trying to maximize the amount of the money they're making, so they're lacing the cocaine, and people are dying. It's destroying families. And, it's even being sold in ways that aren't quite as ordinary, like shooting up cocaine and things like that. So the next thing I ask you to do is what we talked about earlier, is analyzing why you're using. I want you to really think about this. Did it start as fun and now is it masking pain? Is there something else that could be there instead? Or is this just what you want and you want to be a little safer about it? Because on a daily basis, substance use takes so many lives and so many talented, amazing people. Um, so just think about what you can do to be safer if you choose to keep using. And, the next thing would be, what would help you meet the needs of your mind, brain, and body? What is it you're looking for? Is there something else? And do you know who you are? This is something I've noticed a lot lately. I think a lot of people are thinking about it right now. There's a lot in the media and social media about it. Who are you and what are your values? And I think these are things that every human pretty much is working on. So I hope this was helpful, and hopefully, if you are in the process of looking for a clinician, to find one who is going to suit your needs, whatever that is. You know, Personally, if I was in the position of looking for a clinician, I want someone who was not going to be judgmental and, just hold me accountable for everything in a harsh way. Yes, we all need to be held accountable for our actions, but it can be in a kinder way that's not as judgmental and, potentially harmful. So thank you so much for your time, and I hope this helped. And I will see you again in the future for another video. Bye.